Good afternoon, everyone. I'm just going to go ahead and start today's webinar in the interest of time. This session will be recorded and will be available for viewing on demand on our YouTube channel as well as on our website. So I would like to welcome our attendees as well as our panelists today. We're going to hear from Robert Fuller, who's the Managing Director, and Larry Prokopich, who is an account executive, and they are both from Sterasure. They're going to talk with us today about some strategies for reducing labor, staff absenteeism, and pathogens. As well, they are joined by Karen Biggs and Baz Kervil from Menno Place, who have real life experience with using the CASPR product, and they are going to share their experiences with you all today. So without further ado, I'm going to turn you over to Robert and Larry. I will just note, if you have any questions, do put them in the Q&A section at the bottom of your page. And Robert and Larry and Karen and Baz will go ahead and try to answer your questions in real time. We will be running the session for about 35 to 40 minutes, and then we'll have lots of time for discussion afterwards. So without further ado, welcome to Robert and Lori.
Thank you very much, Kathy, and thank you everybody for being here today. Excited to be here and to share a little bit about what Sterasure does, what we manufacture, and some of the solutions that we have for independent, assisted, and long-term care in Canada. So just to give you a little bit of a background on who we are an ISO 1345 MDSAP certified medical device manufacturing company. We're located in Kitchener, Ontario. You can probably see the facility behind me. And we really focus on and specialize in end-to-end infection control solutions. So a little bit about what we're going to talk today with you about is our active, continuous, and autonomous air and surface technologies. We also manufacture advanced wound care solutions, surgical instruments, sterilants, remote resident and patient monitoring systems, as well as a number of other technologies. Our group has quite an extensive experience in predominantly acute care, but some in long-term care and assisted living as well. And going to share a little bit about some of what we're focused on. So some of our infection prevention and control technologies focus around CASPR, which is a continuous air and surface pathogen reduction technology. We also manufacture very pure hypochlorous acid solution, which has a variety of use cases in antimicrobial, antivirucidal, so on and so forth. We also manufacture a specific nanofiber technology mask, as well as hand hygiene education solutions. And as I mentioned, contactless fall detection, as well as contactless vital sign monitoring technologies. Any interest in any of that, we're happy to share that with you. But again, just to introduce myself, my name is Robert Fuller. I'm Managing Director at Sterasure. We also have today with us Lori Prokopich, who's our BC sales representative, and very happy to have and thankful for Karen Biggs, who's the Chief Executive Officer at Menno Place, as well as Baz Kervil, who's a Manager Environmental Services at Menno Place. As Kathy pointed out, they're going to share a little bit about their experience with CASPR thus far. We've been working with Menno for about 2 years now. I'm just going to give you some background on the technology. So maybe to jump right into it, there's been quite an evolution of disinfection technologies over the years. Really the most recent, where we've moved to quat and bleach wipes. You now are starting to see and have seen UV robots in some acute care facilities, as well as long-term care facilities. Some institutions are also using, and homes are also using misters, hydrogen peroxide misters, and other types of disinfectants. Really where we have advanced the technology to is continuous autonomous disinfection facility-wide. So there's no manual intervention of actually cleaning and disinfection. This is something that can be installed and runs 24 hours, 7 days a week. The technology itself is actually based on a technology that was developed in the late 1960s. It was developed by NASA, and it was used to disinfect the interior of spacecrafts in the International Space Station. The technology has made a number of iterations since the late 60s. Fast forwarding to today, CASPR's won a few awards from NASA on their improvements to this technology. Fundamentally, what CASPR does is it mimics an outdoor atmospheric process. So outdoors, we have humidity in our atmosphere that is converted by the sun into very low levels of hydrogen peroxide and other oxidants. We mimic that same natural process inside of a building. And these very low levels of H2O2 or hydrogen peroxide interact with particulate in the air, bacteria, microorganisms, fungi, but also because H2O2 has a molecular weight, it settles onto all surfaces. So you're getting both air and surface disinfection through the technology. We've tested this against quite a host of different microorganisms, even most recently SARS-CoV-2 virus, and we've shown very, very effective inactivation and kill rates against those microorganisms. It's a very easy installation. Many facilities can install right into their existing HVAC system, but we have some other form factors that we'll show you in a little bit, where ceiling tiles can be replaced, compact units can be put into hallways and other types of units and other areas within a home. One of the big areas that we've really had a lot of great feedback on is the ability for this process to reduce and technology to reduce odors within homes, within various types of institutions and facilities. There's no noise, odor, residue from the technology. One way to sort of think about this is when you turn on your shower in the morning, you will see it condensate on the glass. This technology is actually doing that on the molecular level. And so it happens all the time, continuously. Again, I've mentioned a little bit about the technology winning a variety of awards, and it's really composed of three components. The first is a custom designed high intensity light, which interacts with this metal alloy that you can see in the middle photo. Those two components together work to convert the humidity inside of the home into these very low level hydrogen peroxide. The technology does not have any consumables, and it's really replaced every 2 years. I'm going to skip ahead here. So one of the questions that always comes up is about the safety of hydrogen peroxide. We produce a very, very low amount, 0.01 to 0.03 parts per million, and guidelines have a permissible limit of 1 part per million. So we're well below that amount, and we've tested this in neonatal ICUs, oncology suites, where you have individuals that are quite immunocompromised, as well as many other types of installations in commercial healthcare, so on and so forth. Some of you may be familiar with a number of these technologies, whether it be filtration, UV, bipolar ionization. Here's a representation of some of the benefits and some of the advantages of using a CASPR natural catalytic conversion technology. It's a continuous reduction. It's safe to use in any occupied space. One of the inventions by CASPR was the ability to reduce any of the harmful byproducts that were produced by the older technologies when it was originally developed by NASA. So that has all been done away with, and there's really no operator required when using CASPR. Oh, my presentation is frozen here. Here we go. So when we get into CASPR's application within long-term care settings, assisted living, and so on, many of the challenges that we are have endured for quite some time is the amount of additional disinfection that is required to take place during the last 2 years, understaffing, which is becoming a real issue, has been a real issue, and it will continue to be for some time. And also the addition of outbreaks and rolling outbreaks within many facilities across Canada. I wanted to pass a little over to Lori here to talk about some of the increased sick leave that we're expecting in long-term care facilities, but also some of the challenges that many homes are currently facing. Lori, maybe I'll pass that over to you.
Yeah, thanks, Rob. So it's been interesting because I have representation across not only long-term care, but across acute care into emergency departments and critical care departments, including ICUs, et cetera. And the problems across are all across healthcare, I guess is the best way to put it, in that a lot was asked of a lot of people over the last little while. And while it was difficult for people to manage their way through the pandemic, coming out the other end, there have been a lot of people that I know that I've seen move on to take different roles within healthcare because they need a bit of a, they needed a bit of a break from what had happened, and just a bit of a chance to regroup on things. So that, and I have a personal experience myself of my mother-in-law who passed away late last year, and to see that the impact that all of this had on her probably accelerated decline, and it was people did the best they could to manage, and we hopefully don't want to have them have to manage such a situation again going forward. Rob?
Thank you. Here's just to highlight, and I'm sure many of you are aware of the additional requirements that are needed now and into the future, and the amount of additional time and labor that's required for a lot of these new disinfection protocols within homes. So to maybe touch on some of these areas about reducing staff absenteeism, pathogens, and so on, we've done quite extensive studies within mainly acute care settings. But from those studies, we've started to learn some really amazing benefits of implementing a continuous facility-wide technology such as CASPR. One of the most eye-opening was that during one of our trials, CASPR had actually reduced employee absenteeism by 44% within an acute care setting. And that was a major benefit to that hospital with I think they had 1,500 staff in this one building within their hospital. It also, not related to long-term care necessarily, but increased the throughput of shortening room turnover by 30 minutes. But what we are starting to see is in rooms where you may have gathering, like dining halls, recreational areas, this additional disinfection steps that are required can be mitigated by having a technology such as this. You can see actually one of our installations. This is one at Menno Place, actually, our CASPR tile unit, which can replace just a 2x2 ceiling tile, covers about 2,500 square feet. And what it allows is to create a healthier environment for staff where they can get back to focusing on resident care. Fewer sick days, allows people to be at work more often. Again, the additional ability to reduce the fear and anxiety of transmitting SARS-CoV-2. We do have quite a bit of data on the virus, and just again adding these layers of protection that we've come to know are so important in limiting spread. Again, reducing absenteeism, creating a stronger mental health environment, and also a holistic approach to all pathogens, because many healthcare facilities and homes, they haven't just had to deal with outbreaks of SARS-CoV-2, COVID-19, but things that are in the environment, MRSA, yearly bouts of influenza, and go down the list. There's a lot that we're challenged with on a yearly basis. So I'll move through these quite quickly, but it's just to highlight some of the testing that we've done, both in real world settings, but also in the lab. And so here's just an overview of some of the viruses and bacteria and microbacterium that you may be familiar with. We have efficacy against. These are specific to actual hospital and acute care studies, reduction in bacteria, fungi. Again, the reduction in employee absenteeism, and actually at that home, it was operational cost savings of over $413,000 by being able to keep those people at work. Another point of interest is with Michigan State, we actually looked at a decrease in floor pathogens, which is actually something that's quite broad in the literature about transmitting floor pathogens to fomites and how that can be transmitted throughout a home and or an acute care facility. So there's quite a bit of data across that, as well as the ability. We have a few homes across Canada actually using our elevator units because these have been areas of a lot of concern where you have a lot of people coming into quite a confined space, as well as our transit units, which are used on transportation vehicles for moving residents from one home to other sites. And so it's really an end-to-end solution of trying to keep both the air and surfaces disinfected in these. A quick highlight of our ability to reduce the SARS-CoV-2 virus. We showed a 4-log reduction, which is quite substantial. And again, this was a school we actually did, primary school we did in the GTA, where we went in and did this testing over several months to show a reduction in all different types of bacteria within their facility. Again, here's some recent testing we did on school buses as well, and the implementation of this on transit vehicles. So I've covered a lot of this, specifically related to odor control. We will have Karen and Baz talk to this a little bit at the end of the presentation, but we have a lot of anecdotal and data that comes back, comments and feedback from a lot of people using the technology. So we actually went out and tested it ourselves. We were able to show almost an 80% reduction of various odors within a 15-minute period. So quite substantial, and really just adds some substantive data to what we've really been hearing and what we notice when we install this technology. One of the areas that it not just goes over as odors, but also VOCs, our ability to target other things like formaldehydes and other aldehydes that may be in newer facilities, but also older facilities. Again, just some representation of that data there as well. The last thing I'll mention on this before we open this up to more of a discussion and a Q&A, CASPR is the first technology in the world to actually receive a third-party standard certification from Bureau Veritas. Some of you may be familiar with Bureau Veritas and the work that they do. This was an 8-year endeavor to get this in place. And so Bureau Veritas actually will come in and certify a facility to having an active air and surface sanitization technology within the home. And we're working with Bureau Veritas here in Canada. Typically how this runs is whenever we go into designing a facility, we will look at the mechanical plans, we'll work with the engineers to really get a sense of how we can maximize the efficiency of our technology across an entire site. We will then come back with, we have particular monitoring equipment that goes onto the technology so we can be aware of any of the units that could go down over those 2 years and be able to replace them. And we are monitoring it constantly. The last step in that is we actually have a third-party lab that will come in and do analysis, both air and surface quality analysis to verify that the technology is in fact working. And so after all of this is done, Bureau Veritas will actually write the report and certification. It's one area that we're looking to start working closer with accreditation bodies and how this can be part of an infection prevention and control protocol within homes in Canada. And again, happy to share more details on how this program and standard works. So with that, I'd like to again introduce Baz and Karen, maybe just to share a little bit about their experience with the CASPR technology over the last few years, and then open it up to Q&A after that.
Sure, I can take the lead here. So yeah, we entered into this journey of cleaning air about 2 years ago. I guess about the time COVID came around. Before that, I've done a lot of research and introduced aqueous ozone to Menno for housekeeping rather than using chemicals and stuff like that. Excuse me. And so we've been using that for quite a few years. So when COVID came out, we were looking at trying to clean the air in our facility. We have quite old buildings, and trying to find a solution for that. I ran into CASPR and Lori and Rob, and then we introduced it to a unit that we had an outbreak on, and then we just took it from there. We just started growing our units. We use the portable CASPR units, and then lately now we've just been using or purchasing the CASPR tiles, which you saw in the picture there in one of our dining rooms. So all our dining rooms have the CASPR tiles, and then a lot of our hallways have CASPR tiles as well, and then a lot of portable units that we deploy if there is an outbreak, but we always keep those operating regardless. We try and spread them around, so it's worked really well. And then also we've used it for suite turnovers. We put units in there where a resident, we found out they moved out and they'd been smoking in their suite. So we put one of those units in there and put it on away mode. The portable unit have a couple different settings, and that just introduced more ozone into the environment, and really cleans, takes that odor away, and kills any bacteria. And then also we've used it quite a bit for some of the offices. We've got one section here at the hospital that's very old. So some of the offices smell a little, not the greatest, some a little musty kind of. So some of the staff have experienced some allergic reactions, and so we put those units in there, and they said it's night and day difference. They go home at the end of the day, they don't feel tired. So we've used those more now with some of the offices and stuff like that, or people experiencing allergies just for seasonal allergies and stuff like that. So yeah, we've kind of used it for different ways, and it's worked really well for us. And I think I just looked it up, and we have 40 units altogether, compact units and CASPR tiles. So the fleet is growing, and we keep expanding anytime we can.
Yeah, I'll add just a little bit to what Basil said. We're all about evidence-based interventions, and we were lucky enough to be part of a project right at when our first outbreak occurred in 2020, November of 2020. And what we found is they were doing air sampling in rooms that people had passed away in. And what we found was there was suspended virus still in the rooms. And then putting a CASPR unit, the virus would go away. But we've even used it for practical things like staff rooms where you have a bad smell from somebody's running shoes or from somebody's lunch. The CASPR units make the room tolerable and take the smell away, which is lovely. You know, my office is an office that's right below a very moist kitchen, and we often have leakage problems because we've got an old building. And the CASPR unit takes the smell away just with using the units in it. So we've been very, very successful, and the evidence. I mean, I'm a nurse, so you can't tell me about all the tests that these guys are doing, but you can sure tell me by the evidence of what we see in the environment.
Thank you both. Maybe at this point we could open it up to see if there's any questions related to CASPR implementations. Really happy to answer the gamut. Okay, I have to check the chat as well because I know that Kathy, let me close my presentation here quickly. So, so one of the things I would like to add is that we, CASPR has been approved under the new Equip Care funding. So it's CASPR, as well as some of our other technologies, are part of the infection prevention and control stream of funding. If there is any interest, we can certainly field any conversations and really discuss how a CASPR implementation and rollout would look like in a facility. As I mentioned previously, we typically take a very customized approach to looking at building design, how we can maximize both ventilation units, but also tiles and compacts for areas that are have heavier traffic or more gathering. And that's really what we've done. As Baz had mentioned, there are dining rooms as well as some of the corridors, hallways, and other areas that these are typically deployed. So it's a very customized approach to how we handle this.
I can just expand a little bit, Rob, if I can just interrupt for a second.
Absolutely.
The approach that Sterasure has taken right from the very beginning, it has been, this is all about layering, right? Protection is all about layering. You can take it all the way from masks on a personal level, all the way up to what you can do in an individual room, to what you can do in an entire facility. So the products that we have and we support add various layers of protection as required. And that's at whatever level you need to address specific problems, whether it be entire buildings all the way down to individuals. We are invested in that area.
Okay. I don't know if we do have someone in the chat. Yes. Okay, well, I would like to thank everybody. Oh, drop my screen share first here. There you go. I don't know if Kathy there still. Well, I want to thank everybody for being here today. Really appreciate your time. Again, if there are any additional questions or any other clarifications or would like to see any of the data that we discussed today, please reach out to either myself, Lori. I believe our contacts have been shared with you via BC Care. And again, thank you to Karen and Baz for joining us.
Thanks, everyone. I've put the link to Equip Care program page in the chat. And again, reach out to myself, Robert, or Lori if you want some more information, or Snezhna for our Equip Care program. So thanks very much. And this recording will be posted on our YouTube channel. So feel free to share that link with everyone.
Thanks again, Kathy.
Everybody.
Thank you. Bye-bye.